Hello, everybody. This is Dr. Suarez and Rich Gaspari. If you don't know about me, I'm the owner and medical director of Pure Wellness Medical, where we help you to optimize yourself through hormone supplements and optimizing your lifestyle. My friend Rich is very big in the industry of health and wellness. He's former Mr. America, Mr. Universe. He came second year for a runner-up in Mr. Olympia 3 years in a row. His first time, he was third. He won the first Arnold Classic. And this is Rich Gaspari, everybody. So why don't you tell me a little bit about yourself?
Great to be on the show. Yes, I many years ago, I became a bodybuilder in my very early age. I started training when I was 13 years old, started competing when I was 15 years old. And I knew I was driven to become, the best bodybuilder in the world at the time. And I had a lot of naysayers telling me that I wouldn't be able to become one of the best bodybuilders for the fact that I didn't have the right genetics. Guys in California were better. You're never going to be able to do it. And, the one thing I learned, that knowledge is power. And that's why it's great doing this show, is what I learned through the years is I went to, I don't know if you know this, Dr. Dave, is I went to pre-med school, at Rutgers, and I was interested in being a doctor, but what basically changed my path is I became pro at 20 years old. So 2 years of college, I went to pre-med at Rutgers. I ended up becoming a pro bodybuilder, and ever since I never got to go back to school. But I always, definitely believe that the science is what made me very successful. I was the most ripped bodybuilder of my era. I brought a new, brought in new conditioning that no other bodybuilder before me had, and that's what set the standard of the sport. I set the new standard of the sport because I was able to look at the science of supplementation, the science of diet, to really make my gains. When I started, I was the first bodybuilder to know about gluten, and a lot of bodybuilders wouldn't even look at gluten as a means to, like, say, hold water. And I was finding it, like, when I was on a diet, if I was eating wheat products which have gluten compared to eating, say, sweet potatoes and rice that didn't have gluten, I noticed that my skin got a lot thinner and I was getting a lot more ripped. So there was something to that. I had an aha moment that's saying it's the gluten, and I cut all gluten. And now it's a big deal about, gluten-free diets. As you know, it all came back, but I was doing that in the 80s, and I wasn't a doctor, but I just read a lot of books on what gluten can do for a lot of people. There's always allergies to gluten. And that's what I found at an early age. A lot of diet back then was just cut your carbs. I was more into having a balanced diet of complex carbohydrates with my proteins, watching my fats, manipulating my calories up and down to trick my metabolism to lose body fat but keep muscle. So, it's great to be on the show with you because you are a doctor and have been doing all the, you've been doing it all as, in the science part of it. I was doing it more as a layman, just reading about it and doing it on my own body. So that's kind of what's exciting about this this team of my just experience, my history of experience, and what I've done, and what as a doctor. So this is going to be a great show. Like you said, I was the first Arnold Classic winner. I won many Grand Prix shows. In the 80s, from the late 80s into the 90s. Only one man was better than me, and that was Lee Haney, who won 8 Mr. Olympias that beat Arnold's record. And the only reason he beat me is because he prepared for a show, but he had better genetics. The guy had a waist that was 29 inches. His back was wide as hell. And I was, an Italian kid that, from Jersey that, had the mindset to be the winner. But out of all the bodybuilders, there are many genetically gifted bodybuilders I was able to overcome and beat because of the knowledge I had in nutrition, the knowledge I had in training, the knowledge I had in supplementation, even back then, that helped me to become a much better bodybuilder.
It's kind of funny because you started off on the education realm and went towards athlete, and I started off as an athlete and then went into the education component.
Yeah.
I started off, high school athlete. I played 7 years of semi-pro football. I always knew, nutrition and working out was a big deal. And it was important for me to get my gains. But then I ended up getting hurt with football, which made me just say, hey, let me go back to school. And I was trying to figure out what I wanted to do. And I said, well, if I'm going to do it, let me go to the pinnacle, which was medicine. And so I was able to bring my experience from sports into medicine. And I've always found that interesting because a lot of times you go to a doctor and he's talking to you about how you're eating. You have high cholesterol, high blood sugar, but the doctor's 300 pounds.
Yeah.
Or the other component is when you go in to an orthopedic surgeon with a shoulder problem and you're like, oh, doc, every time I do military press over my head, it hurts. And this guy never lifted a weight or played sports in his life. And he's like, well, then don't lift the weights over your head.
Yeah.
The reality is you need to figure out how you're going to change the angle so you can still do it and not get hurt. So by combining all of those things, I think we have a really good synergy of how we're going to be able to help improve people's lives. My whole goal here is to be able to combine the science with the practicality of health and wellness, not just science and not just health and wellness, but you put them together and that's how you really change people's lives.
Well, as you said, if you go back even 20 years ago, the orthopedic surgeons would tell you don't train or don't do this, but now it's gotten more that a lot of the current orthopedic surgeons are looking at, how to, overcome and be able to do that press. And that's what I've noticed, that they've become a lot more knowledgeable. Out of all the doctors, I don't know what type of doctor are you, Dr. Dave?
Well, I started out as a general surgeon.
Okay.
I wanted to do orthopedic surgery because I played sports. I said, oh man,
yeah, you played sports,
get close to the field. But what happened was, as I was doing my education, I just found that I didn't want to be that close. I didn't want to get that taste because I still missed it. So I did general surgery. And then I started to realize I had a skill, which was cosmetic surgery. So when people would come into the emergency room and would have a dog bite on their face or would get slashed in their face, they would be like, ooh, I want the resident to do it, not even my attending, to stitch up their face because I would have such great results. So I did a fellowship in cosmetic surgery. And then what started to happen with me was I was big on giving people nutrition and getting them in shape before any cosmetic surgery. But I just didn't feel fulfilled. They would come back and they would, oh, I want a little more here, a little bit more there. But as I started doing hormone therapy in my practice way back in 2011 and 2012, I started to realize I was changing people's lives just by giving them hormones that they were depleted in. And they would come back to me with loving results. Oh my goodness, doctor, thank you so much. I feel great. You changed my relationship with my wife. I didn't get that from any of the cosmetic patients. So it totally changed the way I thought about how to treat my patients. And I stopped doing surgery altogether and started doing more of the health and wellness component, which is what I do now.
It's interesting. You talk about it, even hormonal therapy, hormones, even to this day, and it's getting much better, they're demonized. You look at the usage of, they put using, testosterone is the same as using cocaine and heroin. And the thing is any kind of drug can be abused. And when you're using a testosterone for bringing back someone who's very low in testosterone, way below normal, like they're 100, on their total T, and you get them back up to high normal levels, and they're, I'm in my 50s, and having that done, it's life-changing, and you can really change a lot of people. Like you said, it brings back, the virility that they didn't have. It brings back, I see, people that are depressed, takes away depression, brings back that, that energy that you didn't have before. but it all, like I said before, was all about, it was demonized as using something that was harmful to you.
Well, a lot of that comes from the knowledge of what we call anabolic steroids, right? Well, anabolic steroids does not necessarily mean a bad thing. It means that it's helping your body to build, right? But when you do it too much, and that's what people see with bodybuilding, right? Bodybuilding is, instead of them getting normal, your mic went out.
It's there.
Oh, there it is. Instead of getting normal levels, you're doing 6 times the amount of testosterone. So you get all the side effects of having high testosterone. You get aggressive, you get muscle bound, you get acne, you get heart disease, you get liver disease, which is all the things that people say why testosterone is bad for you. But in reality, when you're doing it to, I call it optimal range, which is not necessarily a normal range. It could be a little bit higher, but it could be a little bit lower depending on what it is for you, because you tell me that according to your symptoms. And by being able to optimize your levels, we get you feeling like you're 25 again. And that's the big difference, because then you recapture your life. I mean, I know when I practiced with my mentor in Palm Springs, California, I first went out there and some of his patients were like 90 years old. Now, you don't see that in New York or New Jersey, a 90-year-old person going hiking. And I'm going hiking for the first time up a mountain, and they're passing me up, and they're 90 years old.
Wow. Yeah.
Then the next day I'd see them in the office. I'm like, hey, I remember you from the hiking trail. Now you come in New York, New Jersey, he's 65 years old. You're old.
Yeah.
People think of you differently. You go to Florida, 75 years old. You're healthy. Now, what is it? It's because it's the lifestyle is different. We're rushing all the time here. So you get passed by when you get older. Why? Because you don't have that hormonal balance like you had before. When you get older, if you're already in a relaxed atmosphere, you're okay with that. So that's why you seem to be a little bit more active in your 70s, because everybody's slowing down in Florida. Same thing with Palm Springs. But what we want to do is we want to be able to bring, with nutrition, with vitamin supplements and optimizing your hormones, is bring everything back to you at the same time. So you can really bring back that vigor to your life that you have.
No, I totally agree with you. And I mean, just recently, I think I told you I had an incident with my heart, and I caught it in time where I went in for a routine checkup, and this is something also very important to let people know is, I mean, there's ways of preventative, as a doctor, going to the doctor to get, in your 50s, going to a cardiologist to check your heart to make sure you have no issues. And I went in and I found out I had plaque in my arteries. I got the stent, but I was told that testosterone, the cardiologist was like, testosterone is bad for you. That's would cause, bad harm, and it's going to cause you to have more hardening of the arteries. And as a doctor, that's not true, that you could still use, I mean, you can't use what like we were talking about, bodybuilders using 5 times what they should be using, but they could still use hormones to get them to an optimal level, and actually could be beneficial for the heart. Is that correct?
Yeah, well, actually, where you're getting a lot of the benefits from your higher testosterone level, which a lot of bodybuilders don't know, is the conversion into estradiol. And that conversion into estradiol, as it goes through your liver, it's going to lower your cholesterols. And the estradiol is the actual one of the few medications that we have that actually breaks down plaques.
This is what I've heard too. A lot of bodybuilders take anti-estrogens or aromatase inhibitors to the point that it's at 0. And what I was told, and you can tell me if I'm wrong, that it actually can cause hardening of the arteries. Not taking any estrogen, you need a small amount, as a male, correct?
Right. Well, a lot of doctors actually give testosterone with estrogen blockers and HCG, which is kind of a fallacy, because the higher dose of the testosterone will turn off any incidence of the HCG. The HCG will give you a minimal effect of helping you to produce testosterone. The only thing it really will help you do is stop decreasing that testicular atrophy, or the shrinking of your testicles. Which is what most people take it for. The other thing is, when you're taking that estrogen blocker, like I said, it's totally depleting the benefits that you get, which is why you're going to get those problems of heart disease, liver disease. All the things that you get from the protection of estradiol are gone with that estrogen blocker. So I'm very big at taking that off immediately. And the only reason bodybuilders tend to need it is because they do develop a small amount of gynecomastia because of these high levels of testosterone and high levels of estradiol. So what ends up happening, and it's not necessarily just estradiol, they're making estriol and estrone, and that's what's also giving them this gynecomastia. And once you have that actual lump or that actual breast tissue, you need to take that estrogen blocker, otherwise you feel it. It gets sensitive. The only real treatment for that is a surgical removal. And then once you have that surgical removal, then you can tolerate high estradiol levels again. It won't irritate that breast tissue. And that's a component that people don't really realize, but that's something that I'm really hoping to change as we bring this to more mainstream. But one thing that we touched on that you spoke about before, which is the gluten inflammation. I mean, inflammation is huge today. Not only do we have joint inflammation from several of these diseases that are around, psoriasis and rheumatoid, lupus, but we get inflammation on the colon level, which is where we get something called leaky gut, which a lot of people get not from a gluten allergy, which is also called celiac disease, but there's a gluten intolerance, which is a less than an allergy, and a gluten sensitivity, which is the least. So you have gluten sensitivity first, then it's an intolerance, which is a little bit stronger, and then a gluten allergy. Gluten allergy, you can never have gluten, and a gluten sensitivity, you might just notice some bloating, you might just notice a little bit of, loose stools or constipation alternating, and then you have that spectrum. But when you cut that gluten out, all of that's gone.
And that's what I noticed early on, because I documented everything I did when I ate, and when I cut out gluten, like I actually experimented on my body where I was taking in bread and pasta for my carb intake, and then I would do that for like 2-3 weeks, and then I would do a diet with the same amount of macronutrients and carbs. I was taking 300-400 grams of carbs. I would take it in brown rice, sweet potatoes, and oatmeal. And I definitely saw the difference. And like you said, I don't have celiac disease, but I have sensitivity to gluten. And I noticed I had less bloating. My skin was tighter. I looked better. And I was like, there's definite why you can't eat those carbs, and that's something I did, like I told you, in the 80s, that now is a big deal by people saying, you may not have celiac. When I was studying it, it was about celiac disease, but I think everybody has gluten sensitivity. Probably a big portion of people. Like, you can't sit there and eat bread and get ripped up. You're not going to get ripped up on bread.
Well, a lot of that also comes from all the preservatives and all the damaging things that we're putting in our food, right?
Yes.
So if you were to make your own bread, you were to make your own whole grain, full grain, 12 grain bread, you probably wouldn't have any gluten problem. But the problem is all the preservatives that are put into almost anything that we eat right now. Like, if you eat something from a can, you have no idea what's going to happen to you, because that stuff is made to be there forever. It's supposed to last through a nuclear war.
It's stuff in cans.
Right, and you're going to eat that out of a can. So it's really important to know what you're getting out of your food. And if you look at even organic food, right? If you look at what you're getting out of the nutrients now and what it was 20 years ago, there's a big difference. We really have to learn how to refortify the soil. So, like, for instance, a lot of people I know, especially with everything that's gone on in our society and not wanting to depend on the government for food, a lot of people are home farming right now. And when you get a homegrown tomato, it's juicier, it lasts longer, it's healthier, it has more nutrients, because you're putting all of those things into the soil that a lot of these big farming areas are not able to do, because it's very expensive. Right? But when you're cooking your own stuff and you're growing your own stuff in your own backyard, you want the best. So you're going to put all the nutrients into that soil, and you're going to get a better quality of vegetable and fruit than you are when you're going to go get it from a supermarket.
And, it's funny you say that, because, I grew up with a mom, they came from Italy, We always had a garden, always had tomatoes because, you know, we had tomatoes, string beans, zucchini. They were all fresh for the summer. And then my mom would can the, you know, tomatoes because we'd make homemade tomato sauce. And that was so much better than what you know, what the store-bought was with the preservatives. And that's something also, you know, in diet, I've learned that you know, people, there's a lot of people that are against supplementation. Supplementation means supplement, not, you know, you still want to eat healthy. But they're still very hard because of what's going on with the way, like, as you said, this farming now, you know, you have to make tons of vegetables that we need to make. So those nutrients are not the same that when you do a home garden. And this is where not everybody can have a home garden, but you can get the supplements to make up for what you're losing. And this is why, like in my line with Gaspari Nutrition, I sell a greens and reds. You know, I sell a omega-3 fish oil because not everybody's going to eat fish 3-4 times a week. So there's a benefit. I saw why I got into supplementation after my career is because as a bodybuilder, I was seeing the practicality of trying to get all the nutrients from foods, and it was very difficult to do. So there is a benefit to supplementation. I always tell that to people. But
we actually started our own line of products also because a lot of times when you buy a supplement, it has one supplement. And
yes.
so what we did was we looked at the research, and we found by combining 4 to 7 different type of supplements that all work on the same thing, the effect of all of them together works more than high dose of one. And then everything that we use is, you know, non-genetically modified material. It's non-gelatin based, all vegetarian capsules, so anybody can take them. And then you see better results with that stuff. Now, I know that you had Gaspari Nutrition for a long time, and it's probably one of the best supplement brands out there. But recently you started another line, your ageless line. Why don't you tell me about that?
So Gaspari Nutrition's been around for 25 years, believe it or not, because I started it after I retired from bodybuilding. And my passion for making Gaspari Nutrition, because I wanted the best product as an athlete. What was I going to, there was back 25 years ago, supplementation was very basic. It was primitive. And as I saw the improvements, creatine came around, glutamine came around, branched chain amino acids came around. And I saw the benefits of using these to, increase athletic performance. And, nootropics now, to help focus better in the gym and train. All these type of products I made to become a better athlete, that I wanted to help athletes. Now that I'm in my 50s and I'm older, I notice a lot of things happening to my body. We talked about inflammation, aches and pains, leaky gut, brain fog, all these different effects, prostate issues. These are all effects that happen when you get older. And I was looking for really benefits to those type of products. And I ended up saying, you know what, I'm going to make my own line for this, because now my passion is to improve the quality of life. People that are older, they just basically said, I'm just dealing with it because, I got aches and pains. No, there's
part of aging.
Yeah, it's part of being old. No, you can help yourself by, taking certain nutrients and, nutraceuticals, high-end turmeric, which is, a very high curcumin is going to really help your ginger, or different products like that can help the inflammation naturally, instead of using, drugs. Prostate, is an effect that, 1 out of 3 males have issues, after age 50 with prostate. And I saw a lot of companies selling prostate products, but they were hucksters because they're not selling a high quality saw palmetto. Saw palmetto has to come from the berries of the saw palmetto, not just from the leaves and the bark of the tree. And that's what's happening with saw palmetto, because it's a big issue with people. Otherwise, they're just going to get you on a drug, finasteride. The doctor's going to put you, on a drug instead, but then it's going to give you other problems. It's going to give you impotence, by taking those drugs. So I'd rather go the natural level, using natural supplements for the aging issues that we have. So that's why I came up with the line. The benefits of collagen. All these products are things that you can take, and there's much, much more. I know that we can collaborate on so many different products that are naturally occurring. And what's really cool about you, doctor, is that you see the alternative to using nutraceuticals besides just prescribing medicine. You may have to take medicine, but it's great that you can use a combination of nutraceuticals, and if you have to, then medicine.
Yeah, I mean, what I found is probably, I'd say 15, 20 years ago, it became more mainstream. A lot of different types of medicine, homeopathic medicine, naturopathic medicine, holistic medicine, integrative medicine, functional medicine, where they use vitamin supplements as their primary way to cure their patients. And by looking into that and doing the research, I found that you could only get those high quality supplements from certain laboratories or certain companies that make them. Not everybody sells that. You think you're going to GNC and you're getting the best vitamins. It's not necessarily the case. And again, a lot of it, it's just that one vitamin. So that's what got me more into the supplementation component. So if I have to get it one supplement at a time and combine it from other companies, you could be spending $600-700 a month. So
Yeah.
if you're able to combine that somehow into one supplement, which is what you've done with some of your stuff and what we've done with ours, it really is able to make a difference, and it's not going to kill you in the pocket. And then once you're optimized with your supplementation, which is in addition to your food, which people always get messed up, right? You have to have a proper diet. What you're not able to get from your diet or you need extra of is your supplementation. And then once you're optimized with that and there's something left out, your blood work and your symptoms will say, you know what, I think I need a little bit more, especially if you're over 45. That's when the hormones come in, and we try to use bioidentical hormones, which are exactly like the hormones that your body makes. So it's the same molecular structure. It doesn't matter where it's coming from. It's the same molecular structure, so you have less side effects and you can take more higher doses and get all the benefits without the problems.
100%. I mean, it's so, what you're doing now is a great thing, because like you said, you got into the wellness where people have the benefits of learning what's going on with them by getting their blood work and seeing their blood panel, and then seeing what they do through a healthy diet, healthy training. And then, if there's alternatives to like taking, hormonal therapies or glutathione, or so many different types of supplements that you could take naturally. I know I get you guys at your clinic do a lot of like IV treatments, right? That you could take in the vitamins. And I believe in doing both. I like doing the IV treatment, but I do also, take oral vitamins. Tell me a little bit about like using the IV treatment, as opposed to like using the oral treatment. I think you can use a combination of both, correct? To get somebody healthy. Like, I think when I do an IV treatment, it's like giving me like a booster, that I can use to really help my body, and then kind of maintain it with supplements. But then once or twice or 3 times a month, if I'm feeling, I need it, I'll take a glutathione with extra antioxidants and vitamins.
Well, that's actually the perfect way to do it, because unless you're getting an IV therapy because you're deficient in something, generally you just want it to boost your health, right?
Yeah.
And that's what's most important. And IV therapy is able to deliver those nutrients directly into your bloodstream without having to go through your GI tract where it gets depleted, without it having to get activated or detoxed from your body. And that's the benefits, because you get it exactly where you need it. Sometimes you're getting a higher dose, sometimes you're not. And generally that's going to last you a week or two, where when you're doing it orally, which you need in supplementation to IV therapy, that's a daily supplement to keep those levels where you need them. Because you're going to get a high dose, and through time, as it detoxes through your body, it's going to deplete. So then you're going to repeat that on a daily basis so you can keep those levels where you need them. So there's always that combination. Now, the best way to really treat people is a combination of IV therapy, vitamin supplementation, healthy lifestyle, and then if needed, hormone optimization. Now, you should be able to achieve hormone optimization usually with a healthy lifestyle, a good diet, and supplements. But eventually, when you reach a certain age, you're not able to produce it anymore, and that's where the hormones come in.
And you know what I've noticed also, Doc, since I started on hormone therapy, I've had prostate issues because my dad died of prostate cancer. And I really started reading up on testosterone and, and prostate cancer. And what was found through research is that people that get prostate cancer have very low testosterone levels. But then they say that testosterone is really bad to use for someone that has prostate cancer. I know once you have prostate cancer, not to use, they say that it can actually exacerbate the cancer. But to prevent prostate cancer, being on optimal levels of your testosterone will prevent it, because if testosterone were the leading cause of prostate cancer, young people would be getting prostate cancer. This is my thinking. Why are old people that have low testosterone level getting prostate cancer? You know what I mean?
Well, I was just going to say that. When do you think your testosterone levels are the highest?
Probably when you're, 18, 19, 20,
You're
21.
going through puberty, right?
Yeah. From 16.
You know anybody in puberty that had testicular or prostate cancer?
No, that's what I say.
Now, you could get testicular cancer in that age, but you're never going to get prostate cancer, right? There's a lot of research that has been done that shows that prostate cancer is not caused from testosterone. Now, it can grow once you have it, but no studies show that testosterone causes prostate cancer at all. Studies show that higher levels of testosterone are associated with a decreased risk in prostate cancer. And if you do get prostate cancer, it's a less severe type than if you had it before. There's actually one study from Eaton and colleagues that stated the development of prostate cancer does not depend on the level of testosterone, and high levels of testosterone don't increase the risk. There's a lot of studies that I can go into that show there's no increased risk of prostate cancer.
And we can get into it on other shows for sure, because that's something near and dear to my heart. Because I said I had my father who died of prostate cancer, so I'm very aware of. I go every 6 months to urologist to check my prostate, do a PSA test, and I check it because I don't want to get prostate cancer, and it's a very preventable cancer if you catch it early. But also keeping optimal hormonal levels, I think it's going to prevent me from getting prostate cancer even into my later years. And like you said, the type of prostate cancer you get if you have optimal levels is not the one that's very aggressive, the aggressive type of prostate cancer. So I totally agree with you. But I mean, we're going to have a lot of shows to talk about these type of things that cause the aging effect, which is going to be exciting to go into. Inflammation, like we talked about, fatigue, we can talk about prostate issues. There's so many topics that I think you and I can get into.
One of my favorite conversations is debunking or criticizing the common knowledge of hormone therapy. Like, everybody thinks that estrogen and progesterone cause breast cancer and cause cervical cancer. I mean, that's just a fallacy. It's just that the study, which was one of the biggest studies in the world from the Women's Health Initiative, which showed that giving estrogen and progestin, not progesterone and not estradiol, they do cause an increase in breast cancer and cervical cancer. But that study's been defunct because if you give estradiol, it prevents it. And if you give it along with progesterone, not progestin, you prevent breast cancer and cervical cancer. But even in the literature today, in a lot of the studies, they still talk about using progestin, which is a synthetic progesterone, and it doesn't have the same benefits. So those conversations we'll definitely get into. I love those conversations because
that's why I said there's a lot of debunking, and it's still, old school doctors, urologists. We talked about orthopedic surgeons. Like, you want to go to the right people that are up to the, what today is, like what the research is today. And even cardiologists, like we talked about, testosterone shouldn't be given to you, when you get to a certain age, if you have plaque in your arteries, and that's not even necessarily true, So there's a lot of things that we can talk about and how we can prevent plaque in your arteries. That's what I'm looking to do. And I know your clinic has, there's ways to actually break down plaque.
Exactly.
And that's another exciting thing to know, because a lot of times what happens with plaque that I've learned it's genetic. I found out that they asked me, if heart issues in your family. And my mother's side, my grandfather died at 57. I had 4 uncles die of heart attacks in their early 60s, and I'm in my late 50s. So it makes sense why, I had issues with plaque, because it's genetics. But with today's science and preventative medicine and health, you can prolong those bad, side effects that you may have genetically to stay healthy and live longer. You're not doomed because of your genetics always to mean that you're going to die. You can look at those things and figure out or be able to go around those, because you're not going to do the bad things to exacerbate the effects of plaque in your heart, or having issues with your prostate, or inflammation, bone problem, all these things. If you really live a healthy lifestyle, it is the fountain of youth. I always say, like, lifting, cardiovascular training, eating properly is the fountain of youth. It's the only fountain of youth. And then also being able to have a clinic like yourself, have these high antioxidants like glutathione, and vitamins, all these things that you can do to really, prolong your life and live a healthy life. So it's not about prolonging life, it's living the quality of life, I think, is more important to say. Because you said a 90-year-old guy hiking, you don't want to live to 100 and you're bedridden. You want to be able to live a good lifestyle. And that's what I look at. You don't want to be in pain. You don't want to be in the hospital. And, I watched both my mom and dad die in hospitals, and I just don't want that. I mean, we're all going to die. When the time comes, I'm going to die. I don't know if you know, Jack LaLanne was a big mentor of mine. He died at 97. And when he died, he was training every day. Dr. Dave, I met him. He trained every day at 5 a.m. He did this 2-hour training, and he was healthy as hell. But 97, the day before he died, he told his wife, "I don't feel good. I get a little bit of a headache." And he just died. That was it. But he lived to 97 with a high quality of life, no aches and pains. He had a headache, and that's how he went.
One of the things that I've always noticed, so eating healthy and living right, and doing the right things does not necessarily mean you're going to add years onto your life.
No.
But it does add to quality of your life, which to me is a lot more important. If I'm going to live to 70, as long as I'm able to do the same things that I was able to do when I was 69 and 59 and 49, I'm happy. But I don't want to be 82 years old and not be able to wipe my butt.
Yeah,
I want to have somebody taking care of me. And that's what got me into this type of medicine. Like, I'll give you a great example. I had my right hip replacement from years of football done last Wednesday, and I'm already walking without a cane up and down the stairs. Even my therapist is like, "Wow, I don't know how you're doing this."
I don't, when you were talking to me and you were like on the phone, like, I said, "Aren't you rehabbing?" You were already like ready to work the next day. So that's it's great, because you had to have that done because of what you did through the prior. But you're right, it's all about quality of life, and that's what we're pushing here, is the quality of life. It's not that we're going to get you to live to 100. It's how you live the life that you do live, that you live much better.
All right. Well,
so I think we should.
This is great. This is really great. I'm looking forward to getting this show going. We'll start off every 2 weeks, Wednesday at 7 p.m. So if you like it, subscribe. And we'll begin having a lot of topics that you guys are interested in, guys and women. And then we'll eventually have some guests on that can help us to really spread the health and wellness industry to everybody.
Definitely, like you said, subscribe, because we'll get this show on every 2 weeks. On top of that, give us your comments. What do you want to hear from us? We'll definitely talk about it. We have a lot of knowledge between both of us to be able to talk about the topics. And like it. If you like it, we want to grow this show to be big. So I'm really excited to, the future of this, and having us move forward and making this a great show, and great knowledge, great plethora of knowledge that we can help others.
Definitely. All right. Well, nice speaking to you. All right, everybody. Have a blessed day, and we'll speak soon.
Thank you.
Bye-bye.